Hello, we are here today presenting in front of the board on the ethical dilemma between Stacy and Joe on determining the life-sustaining treatment of their child, Absidy. And as a group, we've come to the conclusion that removing life-sustaining interventions may be more beneficial than attempting to extend the life of the child. With the doctor's confirmation of the diagnosis of anencephaly, the child's prognosis is most likely death. There is no cure or standard treatment for this diagnosis, and the lifespan of the child is not expected to exceed more than a couple of days.
Discontinuing all life-sustaining treatments supports the ethical principles of non-maleficence, life, beneficence, and autonomy. If the ventilator continues to be used by Absidy, the principle of non-maleficence is violated. There's no cure for anencephaly, and the prognosis is death, so continuing treatment will ultimately do more harm than good. Furthermore, continuing ventilator use would be considered to be a futile treatment because the doctors involved in Absidy's case do not think that there would be a beneficial outcome. Discontinuing life-sustaining treatment supports the ethical principle of life because the quality of Absidy's life is severely diminished due to her diagnosis of anencephaly. She will not be able to speak, see, hear, or interact with her environment, and she has no ability to make a memorable life for herself. Lastly, discontinuing life-sustaining treatment supports the ethical principle of beneficence because as healthcare providers, we want to take the actions that benefit and promote the welfare of our patients as much as possible. Providing treatments to a patient who does not have a chance at life is unethical.
Discontinuing life-sustaining treatments for Absidy would be beneficial for her autonomy. Even though she has a fatal diagnosis, if the life-sustaining treatments were effective, she will never have a say in her life or medical decisions, which means that she has no autonomy. She was born with no cerebrum, meaning she has no cognitive capabilities or interact with her environment. At this time, she is unable to use her autonomy and decide whether she wants life-sustaining treatments. Therefore, the decision should be based on the clinical evidence that anencephaly is fatal, and we should only continue palliative care, nutrition, hydration, and warmth to keep her comfortable.
In the current situation, we do not believe that Stacy is in the proper cognitive state to determine what medical interventions should take place. Through observation and interactions, it does not appear that Stacy understands the circumstances of the situation. While taking into account Stacy's mental health status of bipolar disorder and her past history of heroin drug abuse, her decisional capacity becomes very questionable. Her recent past history with children shows signs of neglect and sanitary issues. In her current situation, she does not have custody of any of her children. Custody of Absidy is also currently in question with an ongoing family investigation. Evidence backing her current state shows that she appears to lack the moral agency to make this important life-impacting decision. Therefore, we believe that Joe's perspective should be considered more greatly.
Although the decision lies between Joe and Stacy at the moment, a meconium drug screen is pending to decide who has the rights to make decisions in behalf of Absidy. We ultimately believe that life-sustaining treatment should be suspended because it supports the ethical principles of non-maleficence, life, beneficence, and autonomy, as well as the mother's past history with child neglect, bipolar disorder, and drug use.